Audio Jungle. Audio Jungle.
SUNEKOS is a product dedicated to the regeneration of the extracellular matrix, also known as the ECM, hence the concept of biogenesis. Therefore, here is a product that stimulates fibroblasts to initiate the production of new hyaluronic acid and glycosaminoglycans, which then leads to the production of new dermal fibrous proteins, collagen and elastin. The product preparation is very easy. SUNEKOS 200 and 1200 are presented in two bottles, one containing hyaluronic acid and a second containing amino acids. Simply mix the hyaluronic acid with the amino acids. This mixture is now ready to inject into the patient. Please ensure that the patient is properly prepared, the skin thoroughly cleansed, ensuring all makeup is removed. Apply a disinfectant liberally across the area to be injected to protect the patient from contamination. Although this procedure isn't painful, prior to commencing any injection procedure, the doctor can apply anesthetic cream to areas that are about to be injected. This is particularly important in those patients who are needle phobic. Apply the anesthetic cream at least 15 minutes prior to commencing the procedure.
Ma davvero la procedura non è una procedura dolorosa, quindi si può anche saltare questo step.
Audio Jungle.
SUNEKOS is an extremely manageable product, and it can be used according to the preferences of the doctor who injects it, or on the basis of the particular characteristics of the patient.
Sulla base di quelle che sono le caratteristiche peculiari del paziente o della paziente.
The technique that we use to inject the product on the face can be either a wheels microbolus technique or a retrograde linear technique. With the microbolus technique shown in this video, we replicated the protocol of the published SUNEKOS study. We have treated the nasogenic furrows. There are 4 to 5 wheals on the malar region and also 3 to 4 wheals on the outer corner of the eye and on the forehead. Another very important aspect is the choice of needle. To ensure that the product is injected into the medium deep dermis, we recommend a needle 30 gauge or even 32 gauge inserted into the skin at an angle of 45 degrees. The wheels technique can also be used along the horizontal wrinkles of the neck, Venus necklaces, with a needle inclination of 45 degrees as well.
Audio Jungle.
In my opinion, the method that gives better results is the interstitial fluids technique. What is this? It is a technique that combines the concepts of dermal regeneration and biogenesis through intradermal infiltration. but also the concept to favor or hinder the movement of interstitial fluids towards the lymphatic system.
interstiziali verso il sistema linfatico. Per quelle pazienti nelle quali è facile osservare anche
For those patients suffering from liquid stagnation, we can use the centrifugal interstitial fluids technique, starting injections from the central facial area and continue with the microbolus technique towards the peripheral area of the face.
e proseguire con la tecnica dei ponfi verso la zona periferica del viso.
For this technique, we drew points from the central facial region horizontally towards the outer side of the face.
In senso orizzontale verso la parte esterna laterale del volto. La zona centrofacciale, come ben sappiamo, è una zona
The central facial area, as we well know, is a high-density area of blood vessels, but even if the product is accidentally injected into a vessel, it does not cause any risk.
fosse accidentalmente iniettato in un vaso. Quindi procediamo con
Then we proceed with the injections, always with the needle oriented to 45 degrees relative to the skin surface, from the center to the periphery.
verso la periferia. Una volta eseguiti tutti i ponfi, faremo un massaggio.
Once all the wheels are done, we will massage with the fingertips in the direction of the latent facial lymph nodes.
Linfonodi laterofacciali. La tecnica dei fluidi interstiziali centrifuga può essere utilizzata.
The technique of the centrifugal interstitial fluids can be used even when treating the neck, and in this case, draw the points from the bottom up and from the inside out, so aiming the massage towards the lymph nodes.
Esterno, quindi andando a puntare praticamente il massaggio verso i linfonodi sottomandibolari e quelli sternocleidomastoidi.
Procedures for the submandibular and those of the sternocleidomastoid. You draw the dots, you make the wheels, and you massage in the same direction.
È una tecnica che viene fatta sempre partendo dalla regione mediale dello sterno.
It is a technique that is always starting from the medial region of the sternum, going towards the shoulder and the clavicle region. Draw the dots, inject with the needle inclined at 45 degrees towards the skin surface, and you massage in the same direction.
Si fa seguire un massaggio tenendo la stessa direzione. Ovviamente, a prescindere dalla tecnica.
Obviously, the final choice of the injection technique will be made according to the needs of the patient and on the experience of the operator.
L'esperienza dell'operatore. Il prodotto SUNEKOS 1200 è caratterizzato dalla
The SUNEKOS 1200 product is characterized by the presence, as the name suggests, of a higher molecular weight hyaluronic acid that allows us, in the case of particularly emptied faces, to create the volume that is needed, also described as cushion, as a base for SUNEKOS 200.
Poi andremo a lavorare con il prodotto SUNEKOS 200. Il prodotto SUNEKOS 1200 può essere iniettato più profondamente nel derma.
SUNEKOS 1200 can be injected deeper into the derma with the blunt tip cannula and needle technique, using a needle that penetrates deeper with an angle of between 45 degrees and 90 degrees.
45 e 90 gradi rispetto alla superficie cutanea. Con la tecnica dell'ago cannula
With a cannula, for example 27 gauge, you make a hole. Then, using the fan technique, you can inject SUNEKOS with a smaller needle of 30 gauge, releasing the product using an in and out motion as the cannula is withdrawn.
iniettare il prodotto con la tecnica a ventaglio, cioè con un movimento di vai e vieni della cannula in modo tale da rilasciare il prodotto man mano che la cannula viene ritirata verso l'esterno. Con la tecnica dell'ago,
With the needle technique, we will distribute the product deeply into the various locations of the affected area.
nelle varie sedi della zona interessata.
Audio Jungle.
Anche in questo caso possiamo sfruttare
Also, in this case, we chose to use the interstitial fluids technique, however, in the opposite direction, that is, from the periphery to the center.
che cosa significa?
What does this mean?
Le pazienti
Patients injected with the SUNEKOS 1200 are usually patients with a more emptied face and therefore are going to counteract the movement of interstitial fluids. We will obtain a greater stagnation of SUNEKOS in this scaffold using the cushion technique in the central facial area.
Di questo prodotto, di questo scaffold che utilizziamo nella tecnica cushion nella zona centrofacciale. Il protocollo di utilizzo del prodotto.
The protocol for the use of SUNEKOS 200 requires for 4 interventions at 7 to 10 day intervals, which can also be repeated 2 or 3 times a year.
Che possono essere anche eseguiti 2 o 3 volte l'anno. Ovviamente anche
Obviously, in terms of the frequency of use, these are only recommendations and must be adapted to the individual patient needs.
alle singole situazioni dei pazienti.
There are no risks of accumulation, therefore we shouldn't be afraid of injecting too much product. The cushion technique is based on both products, SUNEKOS 1200 and SUNEKOS 200. It starts with the injection of SUNEKOS 1200 followed after at least 2 and no more than 3 days with the initiation of SUNEKOS 200 and then the normal protocol, which is an infiltration of SUNEKOS 200 every 7 to 10 days for 3 cycles.
SUNEKOS 200 ogni 7-10 giorni per altre 3 volte. Per le pazienti agofobiche oppure per completare
For needle-phobic patients, or to complete the results obtained by the injection method, the product can also be conveyed via the electroporation process.
si tratta dell'applicazione
This method consists in the application of a very low voltage current that opens the pores in the epidermal barrier to allow the active ingredients to penetrate better.
far penetrare meglio i principi attivi. Per fare questo conviene anzitutto eseguire una microdermoabrasione.
To do this, first of all, perform a microdermabrasion of the skin. In our case, we prefer to make a scrub by adding corundum crystals to Nutricos face cream in order to have a scrub able to exert a mechanical peeling of the skin.
In modo tale da avere uno scrub in grado di esercitare un peeling meccanico sulla cute, asportare quindi le cellule più superficiali dello strato corneo per poi poter preparare la pelle all'assorbimento attraverso la metodica di elettroporazione. È molto importante.
Please ensure that the face is clean and free from makeup, then perform a microdermabrasion as described.
Alla microdermoabrasione, così come abbiamo già descritto.
Once the microdermabrasion process has been completed, remove the corundum crystals and the cream's residues, then start the electroporation process.
Una semplice garzina imbevuta del prodotto si comincia a passare.
Soak the gauze with SUNEKOS 200, apply the gauze to the skin on the intended area to treat, then move the handpiece over the gauze.
Attraverso la pelle.
This process allows you to clearly see the absorption of SUNEKOS 200 into the skin and penetrating into the epidermis as the gauze is completely dry after a few passes.
Attraverso l'epidermide.